When you picture medicine, you probably think of, complicated charts, dense textbooks, a lot of Latin. But what if I told you that doctors are also hunting for things that look, well, a lot more familiar? It turns out there's this hidden visual language being used in hospitals every single day, one that helps turn these mysterious gray scans into life-saving diagnoses. So let's just start with a little puzzle. What on earth could a breakfast pastry, a tropical island, and a chunk of ice hurtling through space possibly have in common? I know, it sounds like the beginning of a really weird joke, right? But the answer is actually hidden deep inside the world of medical imaging. And there you have it. Each one of those everyday objects has lent its name and its shape to a very specific pattern that radiologists hunt for on X-rays and CT scans. They're basically symbols in a secret language that helps doctors see what's wrong. And today, we're going to decode it together. Now, you might be thinking this all sounds a little silly for something as serious as medicine. I mean, a donut sign? A comet tail? But there's actually a really powerful reason for this seemingly playful vocabulary, and it all comes down to how our brains are wired. This quote really gets right to the heart of it. See, our brains are built for stories and images, not for abstract data. So by linking a super complex medical pattern to a familiar object, doctors create this amazing mental shortcut. It just makes the pattern way easier to spot, to remember, and honestly to teach to the next generation of doctors. Let's just break that down real quick. A radiologist is staring at a scan and it's full of all these complex shades of gray. Instead of just seeing, an amorphous consolidation, they see something that looks like popcorn. And that familiar image just clicks instantly. The diagnosis becomes faster, more intuitive, and a heck of a lot harder to forget. It's a brilliant little cognitive hack. Okay, let's dive into some real-world examples to see how this works. And we're going to start in a place we all know very well, the kitchen. Because it turns out a radiologist's pantry is a surprisingly great place to look for diagnostic clues. So first up, we've got the donut sign. On a side-view chest X-ray, sometimes enlarged lymph nodes will form a white, dense ring right around the trachea, which is the windpipe, so it's dark because it's filled with air. This creates a perfect donut shape that can be a huge clue for things like tuberculosis or lymphoma. And what's so cool about this is just how perfectly the analogy fits. The dough is that solid mass of swollen nodes, and the hole is the airway passing right through it. Seriously, once you see the comparison, you can't unsee it. And for a doctor, that kind of instant recognition is absolutely crucial. Sticking with the breakfast theme, we have the Cheerios sign. These are teeny tiny nodules in the lung that have a little air-filled hole right in the center. It happens when abnormal cells grow around a small open airway. And while they can have a few different causes, they can sometimes be an early red flag for certain kinds of lung cancer. Okay, this next one can literally be a lifesaver. It's called the polo mint sign. It shows up on a CT scan when you're looking at a blood vessel in the lung cut in a cross-section. The glowing white ring, that's the mint, is the vessel wall all lit up with contrast dye. And the dark center, the hole, that's a dangerous blood clot, a pulmonary embolism. Spotting that mint is absolutely critical. And finally, here's a sign that's often a huge sigh of relief for everyone. If a doctor spots a nodule in the lung with these chunky, irregular bits of calcium inside, they call it popcorn calcification. And you know what? Seeing this is usually really good news because it's a super strong sign that the growth is just a hamartoma, which is completely benign. All right, so from the kitchen, we're packing our bags and heading out into the great outdoors. It turns out that nature, with all its incredible shapes and patterns, gives us another huge library of these diagnostic symbols. Take the atoll sign, for example. It's also called the reversed halo. On a CT scan, it looks like a hazy gray area in the middle that's surrounded by a much denser white ring. It looks exactly like a coral atoll out in the middle of the ocean. Now, it was first linked to a specific type of inflammation called organizing pneumonia, but doctors now know it can pop up in a whole bunch of other conditions too. The visual logic here is just, well, it's incredible. That hazy inflammation in the lung, that's the calm lagoon. And the denser ring of tissue packed around it, that's the solid coral reef. All of a sudden, this simple geographic analogy makes a really complex radiological pattern make perfect sense. Okay, this one is really striking. It's called the ginkgo leaf sign. After a major trauma to the chest, air can sometimes leak into the soft tissues of the chest wall.
When that happens, the air gets trapped between the fibers of the big chest muscle, the pectoralis major, and it outlines them in a pattern that looks just like the delicate veins of a ginkgo leaf.
And then we have the tree in bud sign. This pattern shows up on CT scans when the tiniest little airways, way down at the very ends of the bronchial tree, get clogged up with mucus or pus or fluid. They create these tiny little branching lines that look exactly like the branches of a tree that's just about to bloom in the spring. It's a very common sign of infection, especially something like tuberculosis.
Now, it would be so easy to just write these names off as being kind of poetic or cute, but this slide right here shows why this is a truly precise language. Check out these two signs, the air crescent and the monode sign. I mean, they look incredibly similar, right? Both are just a pocket of air around a mass inside a cavity in the lung. But there's a tiny, subtle difference. The air crescent sign shows up when the body is recovering from an invasive infection. The monode sign, on the other hand, means there's a stable fungal ball just sitting there. It's not invading anything. A tiny visual difference, but a completely different medical meaning.
So, as we've seen, these names are so much more than just the little bit of medical trivia. They're actually a really powerful cognitive tool that fundamentally changes how doctors see, how they learn, and how they communicate with each other. At the end of the day, the secret visual language works simply because it taps into the way our minds are already built. It creates these super strong memory hooks, it speeds up diagnosis and improves accuracy, it makes ridiculously complex ideas way easier to teach to students, it gives everyone a shared, clear vocabulary. Really, what it does is it helps turn a flat, gray scan into a diagnostic story that a doctor can actually read. And that really is the key takeaway here. What might seem like a simple, maybe even a cutesy analogy is in fact a highly sophisticated tool for achieving clarity and for building memory. And in a field where clarity and speed can be the difference between life and death, well, that makes it one of the most powerful tools a doctor can have. Think about it. From a subway map that turns a city's chaotic geography into simple, colored lines, to a diagram of a molecule that shows us each shape, we rely on these kinds of visual shortcuts everywhere. So it kind of leaves you with one final thought. Where else in your world is a simple picture being used to make sense of a really complex idea?